Hi everyone, my name is Paul Cohen and I'm at Rockefeller University in New York, and I'm one of the co-organizers of the upcoming Obesity and Adipose Tissue Keystone meeting scheduled for February 2025 in Banff, Canada. Our vision in organizing this meeting was to provide both a comprehensive but also fresh perspective on biology of adipose tissue and the clinical problem of obesity. And so to do that, you'll notice in our program that we span all the way from basic molecular and cell biology of adipose tissue to human genetics of studies on obesity and fat distribution, and then also exploring therapeutics. Well, I think our meeting will stand out because we have a fantastic lineup of speakers from all over the world who are going to share their latest unpublished data. We also have important involvement from speakers and panelists in industry and publishing. And we're also partnering with a meeting on MASH pathogenesis and therapeutic approaches. And it's long been appreciated that there are important links between obesity and fatty liver disease, but this allows two groups with similar but non-overlapping interests to get together and form new contacts and hopefully collaborations. I think attendees should expect to hear about some exciting new advances in human genetics, especially as it relates to the genetics of body fat distribution. They'll hear about the latest basic science as it relates to the development and function of adipocytes. And then we'll hear about emerging therapeutics. There's been a lot of excitement on the therapeutic side of obesity, but there's always more to be done and new pathways to target, and we'll hear about that in this meeting. I'm really personally excited about the human genetics. I think for almost all of us, human genetics is the foundation of a lot of what we do. And it serves as an anchor point for our basic studies as well. So I'm really looking forward to that. I also think this will be a really fun meeting. It's in a great location. We're going to have a great group of people. There will be wonderful opportunities for students and trainees to present their work in the form of posters and short talks, and to form new contacts that will help sort of stimulate the next generation of scientists in this field to carry on the work. In addition to the great scientific content, there will be lots of opportunities for short talks selected from abstracts as well as poster presentations. So for people attending the meeting, two dates to keep in mind: December 4th is the deadline to submit abstracts for consideration for a short talk, and January 30th is the deadline to submit abstracts for consideration for a poster. Well, I think this meeting will highlight some new and unpublished science that will stimulate new collaborations and new ideas, thinking across disciplines. I expect that some of the cross-fertilization of ideas between our meeting and the MASH pathogenesis meeting will bring about new ideas. And then there's always these unprompted conversations that happen in the course of poster presentations or short talks that will undoubtedly lead to exciting things down the road. I think the Keystone meeting is a really fantastic format to learn about what's going on in the field and to make new contacts. And speaking from a personal perspective, I first attended a Keystone meeting in the late 1990s when I was a PhD student. And although that seems like a million years ago now, I made some contacts back then when I was a student who remain colleagues and collaborators in the field. And I think that's very common and within the spirit of these meetings that those sorts of things come about. We think this meeting will be of broad interest to basic scientists, translational researchers in the field of obesity and metabolism, and to people in industry and biotech. So we really encourage anyone who's thinking about it to take a look at the program, consider signing up, and we think you'll really enjoy the time.